At the height of the pandemic, as doctors worked overtime to treat skyrocketing COVID-19 cases, other medical procedures took a backseat, including preventive cancer screenings. Now, health experts warn that could have deadly consequences in the years to come.
That's because although people stopped getting cancer screenings, they never stopped getting cancer. Dana Smith has what you need to know that could save your life.
The coronavirus pandemic has taken a toll on a lot of us. For Norfolk resident Yvonne DeMar Freckleton, she got some bad news.
I was diagnosed with breast cancer, stage 2.
Her cancer diagnosis came in 2020, right at the start of the pandemic, after she noticed something was off.
I felt a lump on the top of my breast.
At the time, COVID cases were on the rise, and Virginia was heading towards mandatory stay-at-home orders. Hospital beds were filling up, and non-coronavirus medical procedures were on the back burner.
I was scared. I'm not gonna lie, I was scared.
Health experts say there was a big drop in cancer screenings, testing, and treatments at the start of the pandemic, and we're still not entirely back on track. The National Cancer Institute has issued a dire warning. Thousands of people could die over the next decade from cancers that could have been detected earlier had the COVID pandemic not interrupted the healthcare industry.
So when COVID first hit, we were down to zero for most screenings. Facilities were having to really focus on the pandemic and patients, needing emergent care.
Sentara's director of oncology service line, Meredith Strand, said 35% of patients missed a recommended cancer screening during the pandemic. She said Sentara officials put a temporary hold on screenings as COVID cases skyrocketed. But even when that was lifted, not everyone rushed in.
We are quite concerned about those that have not had their screenings, that have missed for a year or a couple of years, and what that might mean for later stage diagnoses.
She said if you fell behind on your screenings, now is the time to make an appointment.
We know that there are a lot of priorities right now with COVID and the many changes, and so to some degree it's procrastination. If a patient is not symptomatic, now doesn't really feel like the time.
Cancers like breast and colorectal can be treated easier if caught early. Staying on top of regular screenings is key to prevention. For Yvonne, going to the doctor during the pandemic to get that lump checked out might have been the difference between life and death.
I don't even know if I would be here sitting down talking with you.
Sentara healthcare officials want you to know heading back into a medical building is safe, and it could save your life.
Life is too important. Life is too precious. For me right now, I'm so blessed. I'm grateful to God.
Dana Smith, 13 News Now.
And Strand said cancer screenings returned to near pre-pandemic levels this summer, but there are many people who are still reluctant, including racial minorities, those in rural communities, and people who speak English as a second language.
She said the hospital is working on community outreach to ensure no patients fall through the cracks.